We've been working on the McMaster Antibiotic Access and Capacity Project for the last year. It was a collaborative effort between CAIC, Canadian Antimicrobial Innovation Coalition, and a group of faculty at McMaster spanning a number of disciplines. So, fundamental scientists like myself, we have infectious disease physicians, health economists, people who specialize in resistance like Jerry. And what we were trying to do was to understand the level of access to new antibiotics in Canada. So one of the issues that arose early in this project is that the FDA has approved 18 new antibiotics in the last 10 years. And of those 18 antibiotics, only 2 have been approved in Canada. And we spoke initially to hospital pharmacists and infectious disease physicians about the problems that they were having getting access to new antibiotics in Canada. So, they have to go through a very labor-intensive process to try to access antibiotics for their patients that have multi-drug resistant infections that do not respond to first-line antibiotics. And, because time is often of the essence for these drugs to get into the patients, they were completely frustrated with the situation that companies were not bringing their antibiotics to Canada because it's a small market and the return on investment is not there. So we tried to understand, at all levels, where are those barriers coming from? Is it at the market access level, or is it at the supply chain level? Is it at the paperwork, regulatory level? How do we get those antibiotics into the patients in a timely manner? So that's the crux of the project. I would say probably aside from the fact that we have access to so few of these new antibiotics, the thing that surprised me the most was even the antibiotics that are approved in Canada are difficult for doctors to get a hold of. That was really surprising to me. And, partly it has been supply chain issues that are caused by the pandemic right now. But just in general, I think it comes down to money, because the way our healthcare system is organized, the federal government transfers money to the provinces transfer money to the hospitals, and the hospitals decide how to spend that money. And so buying a new antibiotic or a novel antibiotic for a patient comes out of the hospital's budget. And so not only does the doctor have to contend with the regulatory aspects of trying to get a new antibiotic that's not easily available, they also have to contend with the financial aspects of this. And, it should not come down to whether a hospital is willing to buy an antibiotic to save a patient, right? And what has been happening is oftentimes the patients will get, instead of the new antibiotic, a combination of old antibiotics that have more side effects just because they're already on the hospital formulary and they're easier to get a hold of. So, expediency should not be the way you treat a patient. You should be treating a patient with the best possible therapies. The way to fix this problem is to spend some money, right? So we've been encouraging people, to think of antibiotics as fire extinguishers. Right. So this is an analogy that was first proposed by Dr. John Rex from Texas. And I love it because, if you think about it, many people buy fire extinguishers. No one ever really wants to have to use it. Right. So this is how we need to think of these new antibiotics. You need to spend the money to have the potential for their use. Right. Even if you don't actually use them. And I think people need to wrap their heads around that, because antibiotics are a very different kind of medicine than most other medicines that you buy, you use, and you're done. So we need to think of a way to incentivize manufacturers by, paying them upfront, essentially. So we can look to COVID for this, right? So this is how many of the COVID vaccines that we're all desperately scrambling to get our hands on were developed, right? The government's made commitments to the manufacturers. If you make this vaccine, we will buy X numbers of millions of doses. And that way the manufacturer has the understanding that they're going to recoup their investment and their risk, right? So this is how we need to think about antibiotics as well. And I think the COVID example shows us that this is doable and that it's really important for public health. We talked to people across the antibiotic supply chain, as I mentioned, right? All the way from the people who are actually putting these drugs into patients, right? So frontline providers, all the way back to the manufacturers. And we tried to understand how we might make this system work better to get antibiotics to people in a more timely manner. And so we developed a proposal that we are sending to the federal government describing how they might do this better, right? So how could you remove some of the financial and regulatory barriers that stand between patients getting these antibiotics? And it's a complex proposal, as you can imagine, because there's a lot of players along the pipeline. But essentially what we would like to do is pilot a incentive in a local region first, right? So basically allow a hospital to have a separate envelope of funding to buy these novel antibiotics, just to have them in case they need them, right? So it sounds odd, it sounds like an odd idea, but I really think people need to wrap their heads around this idea that you need to have these things on hand just in case, right? And we do, we understand the amount that we would probably need, because we have looked at what people are trying to get a hold of now. And, that's probably an underestimate, actually, because a lot of people don't even try, because the hassle factor is way too high. So they don't even try, right? But I think we could do much better by patients by incentivizing hospitals, giving them a separate pot of money just for these antibiotics, so they don't have to carve it out of somebody else's budget or some other unit's budget. And then once we test this idea in a smaller region, then we can expand it to the province and then eventually across the country.